Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant Orthopedic Surgeon at Chennai Ortho Clinic, and today I'm going to talk about a very common topic, patella dislocations. The patella is your kneecap. It sits in a groove and is normally kept in position by the muscles and tendons around the kneecap. So if you have a very shallow groove where the kneecap sits, or if you have a hyperlaxity of ligaments around this kneecap, you have a tendency for that kneecap to dislocate. So this can be very worrisome to some parents because it happens in the early part of the childhood or in the adolescent age group. It can be troublesome for the child because he will not be able to play sport, or he will not be able to do certain movements like stretching out. Sometimes even when stretching out, when you have very lax ligaments, your kneecap can actually subluxate, that is move out of the groove and go back into its position. But very rarely, if you have an injury or if you have a very lax ligament, the kneecap can come out of the groove and not go back into place. This can be very painful and may cause you a visit to the emergency to get it reduced under some sedation or with painkillers. So this problem can be addressed in many ways. Firstly, when you have this problem, we need to assess you to see for your hypermobility status, to see whether your ligaments are lax or they are in the right position. We also need to assess you to make sure that your bony anatomy is normal, for which we will do x-rays and if required do an MRI to assess the groove of your kneecap. Based on these, we will realize that if at all you have a problem, we will try to rectify it for you. Once you have had this problem, we can start you on rehabilitation exercises, which we call physiotherapy, to strengthen the muscles on the inner side of your kneecap, because the most common problem for this is that you have an injury to your kneecap and you tear the inner side muscles and the kneecap pops on the outer side. So once it goes back into place, the inner structures which are torn need to heal well, and then after that you strengthen the inner muscles. This will keep your kneecap in the right position. If you have a high riding kneecap, which we call patella alta, which we see based on your MRIs and your x-rays, then obviously we need to make sure that your kneecap brought to its correct position. This young boy came to me many years ago with the same problem of his kneecap dislocating. I had treated him in the emergency and his kneecap was put into place. He continued with the same problem using braces for this for a very long time, trying to keep the kneecap into position. You can see how his knee was prior to the surgical procedure, and you can see how his kneecap is shifting out of place and going back. This was treated operatively, and you can see how well he is able to bend his knee and do all activities after the procedure. Usually we try to avoid any surgery, and if you have these kind of problems, we wait for you to reach an adult period. Like if you are a child, probably around about 18-19 years, we wait for that period before we offer you any kind of surgical treatment. Now if you ask what surgical treatment is available for this, if you are suffering from this problem and it's really bad and you have done all kind of rehabilitation procedures for this, you have strengthened your quadriceps muscles, you have strengthened your structures around your knee, and if in spite of that you are still having a problem of repetitive dislocation which is affecting your daily life, Then we tighten the structures on the inner side of the knee by doing a ligament reconstruction, which we call an MPFL reconstruction. And by doing that, we are able to provide you a very stable kneecap by which you will be able to do most of your activities and can go back to your normal lifestyle.
Thank you, Dr. Senthil, for treating both my knees and allowing me to resume the normal life I enjoyed before these issues first appeared.
I hope this short video has given you some insight into patella instability or patella dislocations. Many thanks.